Good afternoon, everyone. My name is Kate Ertman. I am the president of the Rotary Club of Portland, and it is a pleasure to virtually see each and every one of you here today. Welcome to our online video weekly membership meeting. So I wanted to start this week off by asking all of our members, can you please fill out the survey that you have been sent if you haven't already filled it out. It is an online survey, and you should have received the email from Riley Research in your email box. You will recall Riley, of course, from our former club member, Mike Riley. And it might actually say survey research in the from line. I think it's a little different for depending on what kind of email you have, but check your spam email if you haven't seen this email yet. It should take you less than 15 minutes to complete, but we do want you to do it thoughtfully, please. We are a membership organization, as you all know, and we're asking everyone to please share their opinions on club preferences, on activities, and on priorities. Of course, our club looks very different today than it does when we're not in the middle of a global pandemic. However, this survey aims to understand the interests, the values, the preferences of all of our club members in general, as well as really how we're going to plan for the future. We are finishing up our second of our 3-year strategic plan, and our incoming president, Ruth Shelley, she will absolutely be referencing the information that is gathered at this survey, with the survey, in as the next strategic plan is formed. So most of the questions do refer to pre-pandemic, also known as normal times, as I've heard it called, but there are some questions that are applicable to the current times right now and how we are conducting our club business virtually. So again, I thank you very much. If you could get it done by the end of this week, we all would greatly appreciate it. Thanks. Now, please welcome Rotarian Wes Harper to give this week's reflection.
Thank you, President Kate. Hello, all. Since next Sunday is Father's Day, I'd like to share with you 2 poems about fathers. And as you'll hear, they're fathers of very different generations. The first is Those Winter Sundays by Robert Hayden. Robert Hayden is an African-American poet born in 1913, and he was named the consultant in poetry for the Library of Congress, a position that's now called the U.S. Poet Laureate. So, Those Winter Sundays by Robert Hayden. Sundays, too, my father got up early and put his clothes on in the blue-black cold. Then with cracked hands that ached from labor in the weekday weather, made banked fires blaze. No one ever thanked him. I'd wake and hear the cold splintering breaking. When the rooms were warm, he'd call, and slowly I would rise and dress, fearing the chronic anger of that house. Speaking indifferently to him, who had driven out the cold and polished my good shoes as well. What did I know? What did I know of love's austere and lonely offices? The second poem, I'll need glasses for it. This is also by an African-American, Joshua Bennett. It's called Dad Poem. No visitors allowed, is what the masked woman behind the desk says, only seconds after me and your mother arrive for the ultrasound. But I'm the father, I explain, like it means something defensible. She looks at me as if I've just confessed to being a minotaur in human disguise. Repeats the line. Caught in the space between astonishment and rage, we hold hands a minute or so more, imagining you a final time before our rushed goodbye. Your mother vanishing down the corridor to call forth a veiled vision of you through glowing white machines. One she will bring to me later on, printed and slightly wrinkled at its edges. This second-hand sight of you almost unbearable, both for its beauty and necessary deferral. What can I be to you now, smallest one, across the expanse of category and world catastrophe? What love persists in a time without touch? That's it.
Thank you so much, Wes. That was, as I expected, was going to be apropos to both the time that we're in right now, as well as Father's Day coming up this weekend. So thank you so much for pulling those together for us. Now I'd like to welcome any virtual guests that may be watching this right now. If anyone's watching this with family, friends, I hope you can, I hope you're enjoying sharing this with each other, in that this is Rotary, this is part of our fellowship, and you'll get to hear more about some of our service work coming up. I'd also like to say that it's June. Yes, it is June. It's about midway through June almost. And I would like to extend a happy anniversary to everyone that is celebrating their Rotary anniversary in this month. If you look on our website, as well as in the email that you have received this video, you will know who became a Rotarian in the month of June some year back. And as always, my fellow Rotarians, if you would look at this anniversary list, and it's a great way to maybe decide who you're going to reach out to this week if you haven't already, or even if you have already. This is a great list to reach out to the folks on the list to say thank you so much for being a Rotarian, and to wish them happy anniversary, and in general, just thank them for their years of service above self. Next up, Youth Exchange. Each month we do highlight one of our committees, and for the month of June, it is our Youth Exchange Committee. So last week, we got to hear from Jess, our inbound Youth Exchange student from Mexico, and she is still here in Portland. This week, though, we get to hear from Anya Naidu, and she is from India. You probably all remember her. She would start our weekly meetings, our guest introductions each week when we were all at the Sentinel. So she was able to get back to India a few weeks back, and she recorded a video. So due to the time difference, we will now be playing that video of her talk.
Hi everybody, good afternoon I guess. I hope you guys are still enjoying the meetings even though they're online. I'll introduce myself even though it's a video I'm sending. I'm Ananya Naidu and I was an inbound in Portland, Oregon. Now I'm a rebound from India, a rebound in India. But I miss all of you, and I wish I could talk to you guys in person or like through a video call, because I have gotten to know so many of you people and I absolutely adore you guys. My travel back to my city was quite stressful and very, very long. In fact, I just got back to my city like a few days ago. I left Portland a month ago, and actually the beginning of May, and I had to stay in a hotel for 14 days. I was alone. It was a quarantine for 14 days, and then I was stuck in the city for a few more days because there was a lockdown imposed in my country, so no one was allowed to travel or drive around, in fact. And my parents somehow got permission from the government, and then they drove to my city. Not my city, but the city I was in. It's like San Francisco to Portland for the city I was in to my city. So my parents drove and picked me up and drove back home. So I just got back, I just met everybody, and I think it's just hitting me that I'm back here, because like till I was in quarantine or in the other city, it still felt like I wasn't home and I was still on vacation. Not vacation, but traveling. So it just feels very real now that I'm home and meeting people. Well, social distancing, but still meeting people. But I hope all of you are doing well and are in good health. I hope you guys aren't bored in quarantine and self-quarantine. Yeah, that's what you guys are doing. You guys should be very happy that your country isn't under lockdown, because it's very weird here because everything's shut, but people have started to go outside, so it's a bit better. My wishes to everybody, and I hope to talk to you soon. Bye.
fantastic. I'm so glad that we got to see her and get to hear from her, because I was wondering what I know that David Knoll and the rest of the exchange, of the youth exchange committee, had been working really hard to try to get her back to her home. So I'm very glad that she made it, and she looks great, and she's as positive as she always has been. And hopefully we will get to hear from her again, as she is now, of course, a rebound, and maybe she'll come back and visit us again. That would be delightful. Next up, we have community grants. Could you please welcome one of our community grant recipients, Preston Korst from the Habitat for Humanity.
Yes, hello everybody. Like she said, my name is Preston Korst. I am from Habitat for Humanity. I want to first just say thank you so much for letting me speak to you in this weird time and a weird format for all of us, as we're slowly sort of adapting and getting used to it. Quickly, let's go over my role. I am a sort of a communicator for the organization at Habitat. I write grants, I write stories, and I manage a small portion of grants with local private institutions that mostly involve philanthropic grant giving. So that's basically my role. I'll go over quickly what Habitat is, and then what and how Rotary has helped us in the past, as that is probably how you all know me. So Habitat for Humanity, we are a home builder and a home repair organization here in Portland. Though we started in the civil rights era, actually, with a small township called Koinonia Farms that was produced in southwest Georgia, with sort of a radical premise that everyone deserves safe and affordable shelter, no matter who you are or where you come from. And that sort of spread, as a mission does, into a larger organization that has its tentacles sort of all throughout the world now. Many of you probably know us by Jimmy Carter's involvement and the famous volunteer days that we have. That is sort of the staple of the bread and butter of where we get our support and how we build homes. We've been in Portland since 1981 and started building sort of house by house to over, I think now we're at about 35 homes a year, and we serve in service to the sort of civil rights mission that we have. About 90% of our homeowners are people of color, and we come from a very diverse background. We build basically all throughout Portland. We have 2 active projects right now in northern Portland, northeast, in the Portsmouth neighborhood, and then in the Kenton neighborhood. We're currently building a total of 42 homes. And we also repair homes as well, and we have what you might call retail stores. We have 4 in the Portland metro region. They're called restores, appropriately, I think. And so that's basically the basics of who we are. And we have 30 homes we're building per year now, but we are looking to expand and grow our mission to build over 100 homes in the next couple of years. That's sort of the target that we're hitting. And in service of that, we've been looking for community support, and that involves volunteers, fundraising to reduce costs and subsidize some of the housing that we sell to homeowners, because we do build homes with homeowners and then we sell the homes to them. So we aren't a rental servicer or anything like that. It's a homeownership mission. So as part of that, again, back to our roots, we welcome a lot of volunteers to our build sites. I think last year we had over 4,000 people volunteer with us, and we are pretty much at capacity on all of our levels. So in the fall of 2018, we sort of looked at ways we could grow that number of 4,000, which is pretty impressive as it is, to even higher heights, which is how we came up with the idea of the Playhouse Experience, which is a volunteer-based program where we work with organizations and businesses as sort of a volunteer engagement experience for them. They come out, or we go to them and we build smaller playhouses, literally playhouses for kids. And then we donate them to selected organizations such as the Dougie Center, the Autism Society of Oregon, and I think United Cerebral Palsy of Oregon and Southwest Washington. So that's the basis of the program. It's profit generating. We typically charge, I think, about $1,500 per group. They come out, they get to have a community building experience. They build these homes, and then we donate them to worthy causes. And that's what Rotary essentially helped fund with their community grant that they gave in the past year. What you guys did was, with your foundation, you gave us a grant that helped us buy supplies, tools, and overall just materials to get these playhouses sort of in our possession and ready to be built. And so yeah, that's basically the basis of what we were able to do. And we built 15 homes in the last year. And of course, everything is on pause right now. But with your guys' donation, we were able to buy tools and materials so that when we do come back, we're ready to go when folks feel safe. I'll relinquish my time right now, but if you guys would like more information on the program, feel free to go to our website at habitatportlandmetro.org. And if you could get in contact with anybody from Rotary, I'm sure they'd be happy to float my contact information to you. So that was in a very quick speech. That's Habitat at about 30,000 feet and the program that you guys supported. So thank you so much for your support.
Well, thank you, Preston, so much for being able to be here today and to tell us about what our community grant were able to do for you and your organization. And it sounds like really good stuff. So thank you.
Yes, absolutely. And if you guys have any questions, feel free to shoot my email out to anybody or anything like that.
You got it. Absolutely. We will make sure we'll point them to you, just to you. You're gonna get a ton of emails now. All in phone calls. Everyone's gonna
bring it on.
Well, thanks again for being able to participate and tell us about it today. Now I'd like to welcome our Vice President, Ruth Shelley, who will be presenting this year's Paul Harris Fellows. Ruth.
Thank you, President Kate, and good afternoon, everyone. I wish we could honor this year's Paul Harris Fellows in person, because this giving milestone deserves our real-time applause. As you know, the first Paul Harris certificate requires a contribution of $1,000, and each additional Paul Harris award is $1,000. Gifts from these individuals contribute to the humanitarian and educational programs of the Rotary Foundation, providing education opportunities, food, potable water, healthcare, immunizations, and shelter for millions of people. During this pandemic, we're all reminded of how we're linked as global citizens. And through their gifts, these Paul Harris Fellows save and invigorate the lives of people around the world and enhance international fellowship and understanding. And so it's my honor to announce today's Paul Harris Fellows. They include Bob Lloyd, his first, Augustine Enriquez, his 8th, Chi Wu, his 4th, Mike Schwab, his 5th, Jim Parker, his 7th, Kate Ertman, her 5th, Alex Huffberg, his 6th, Ray North, his 4th, Sun Lee, his 4th, David Noel, his 3rd, Don Livingstone, his 4th, John Evans, his 2nd, Drew Henry McWilliams, his 2nd, Maria Schell, her 1st, Jim Dunn, his 3rd, Kim Cash, her 6th, Dick Corder, his 3rd, Walter Van Dornick, his 5th, Viral Yasalada, his 5th, and Mike Arthur, his 1st. Congratulations to all of those Paul Harris Fellow recipients. But wait, there's more. We also have a new major donor for the Rotary Foundation, which means lifetime giving of over $10,000. Congratulations to Leslie Brunker for her major Paul Harris Donor Award. And now, a few of our Paul Harris Fellows will talk about why they've chosen to support the Rotary Foundation. Drew, can you start us off, please?
I'd be happy to start us off. So I'm out here at the Rotary Youth Center, and my update is windows and garage doors are being installed. The roof is on. Progress is significant. And I forgot to bring my pin in, but I didn't forget the new t-shirt we have. So for me, why I give is I do believe there is good in the world. And what I most appreciate about our Rotary Club and Rotary International is that we believe taking words and putting them into action is what we do. This is one piece of action. All of our committees are action oriented, and that's why I give to the Paul Harris Award and funds. Thank you.
Drew, that is fabulous. We love being on site with you. It gives us all hope that we can get outdoors again and see it for real. And now, Beryl, would you like to give us a few words, please?
Thank you, Vice President Ruth and President Kate. I give to Rotary because I know it's going to make someone's life better around the world. From clean water to healthcare, to education, to world peace, Rotary has been doing an amazing job for decades. And there is no doubt and no concern in my mind that giving to Rotary is the best way to promote well-being of other human beings around the world. And that's why I give to Rotary.
Beryl, thank you. That really underscores the return on investment for any gift to the Rotary Foundation. And now, Leslie, congratulations.
Thank you, Ruth. I give to Rotary because I know that my dollar goes to all the good things that Rotary does. And I love that I'm following Drew and Beryl because to me, they represent the local and the international. And I love that about Rotary is that we're doing so many wonderful projects in both places. So recently, I received this lovely crystal that has, actually it's so perfect for me because it has two peace doves on it. So all of my work in peace building, so great. And that's not why I give, but that was such a nice acknowledgement from Rotary International. And of course, a pin, because we love our pins. But anyway, I appreciate the acknowledgement and love contributing to Rotary. Thanks, Ruth. Thanks, Kate.
Thank you, Leslie, and thank you all for your extraordinary generosity. Finally, we'll hear from President Kate. Kate?
Thank you, Vice President Ruth. I got my pin right here. I haven't pinned it on me. My hair tends to get in the way sometimes, but thank you so much. And the reason why I always am every year, as much as I can, I commit to the Rotary Foundation. I'm a person who loves processes. I'm a person who loves systems. And from the beginning of being a Rotarian, I've always been quite flabbergasted of how this beautiful system that has gone on for over 100 years is able to keep kind of reviving itself and finding places all over the world that need assistance and need support. And so it's a very dynamic system that is with basically folks like us and clubs all around the world who have boots on the ground who are able to reach up to Rotary International and say, hey, we think that there should be some work done in this place, in this country. And because of the great system that is in place, I know that anytime I make a donation to the Rotary Foundation on the international level, I know that someone is thinking very, very, very clearly and with much information with that whole system of how best to use those dollars and make the most of them. So that is why I always give to the Rotary Foundation whenever I can. Thank you again, Vice President Ruth. Oh, soon I'll be saying President Ruth. Thank you, Vice President Ruth, again for doing the presentation today for our Paul Harris. And thank you, everybody that was able this year to receive the Paul Harris Fellow. Thank thank you so much for your time and for your contributions. Now I would like to welcome Rotarian Jim Dunn, also past President Jim Dunn, as today's chair of the day.
Thanks, Kate. Before I begin, I would like to take a moment to say how much I appreciate the fantastic job you have done during your presidency in leading this club during this challenging time. Thank you. It is my pleasure today to introduce our speakers on a topic that is vital to everyone: the future of healthcare in the world of COVID. You all know one of our speakers very well. Dick Clark is a past president of our club and chaired the Oregon Ethics and Business program for 2 years. Dick's roots in Portland are very deep. His grandfather had a grocery store on Northwest 23rd near Vaughn Street. In high school, he sold soda and popcorn at Civic Stadium during baseball and football games. Those early experiences, roving the aisles for customers, have served him well. You cannot go anywhere in this city with Dick without running into someone who he knows very well. He is a graduate of Central Catholic and a proud graduate of OSU. After a short stint in journalism, Dick became the executive director of the Portland Rose Festival, where he learned how to handle the unexpected at every turn. Dick spent many years working as a development director for Providence, where he helped raise more than $74 million for cancer research and healthcare. In 2008, he was named the executive director of the Providence St. Vincent's Medical Foundation with $185 million in assets. In 2015, Dick became the CEO of the Portland Clinic. And his greatest challenge yet, in March of 2020, he came face to face with the world's largest pandemic in over 100 years. Joining Dick today is Dr. Amy Mulcaster. She is the Chief Medical Officer for the Portland Clinic. She is a practicing GYN specialist at the Beaverton branch. She is an advocate for women and provides her patients with knowledge that they need to make informed decisions about their health. She is originally from Michigan, where she completed her medical training at Michigan State University and her residency in obstetrics and gynecology at St. John Detroit Riverview Hospital. After practicing for 4 years in Michigan, she saw the light and traveled west to join the Portland Clinic, where she has practiced these last 12 years. Now I'll turn this over to Dick and Dr. Amy, and they will share with you some of their insights about healthcare business, clinic changes happening now, and how to plan for the future.
Wow, Jim, I want you to be my campaign manager. Thank you so much for that kind introduction. And I also want to echo what Jim said about President Kate and the wonderful work that she has done to keep this club together under such extraordinary circumstances. So today's program is going to be two-part. I'm going to talk a little bit about the business of healthcare and specifically at the Portland Clinic. And then I'm going to turn it over to my friend and colleague, Dr. Amy Mulcaster, who will talk about the quick advent of telehealth and how it's going to be now and in our future. Siobhan, I believe you're going to be helping me with some slides. Thank you very much. So here's the title of our program. Obviously, this is a story that is being written as we speak, but I'll call this as a check-in that we're doing right now. And I think that there are going to be a lot of informed programs in the future about COVID, not only how it affected and has affected healthcare, but really this whole world. But today is a small slice into a view of healthcare and specifically the Portland Clinic. Next slide. So I was thinking of putting COVID where it says disrupt, but suffice it to say that it's disrupted healthcare in a huge way. We've all read about how hospitals, especially in the East Coast, severely suffered during this COVID crisis. Fortunately, with the leadership of Governor Kate Brown, the curve has not only been flattened here, but we really didn't reach the crisis situation in cities like New York City. Nevertheless, it was hugely disruptive to healthcare. And I've talked to some people who have thought this has been somewhat counterintuitive. They thought that, if anything, healthcare would be doing quite well during this time. But of course, we know it hasn't. Next slide. So I just wanted to kind of give you an overview of pre-COVID state of the Portland Clinic. Thankfully, many Rotarians are patients here at the Portland Clinic. Many use our facility, which is located just a couple blocks from the Sentinel Hotel. This building was built in 1974, and I'll be talking about it a little bit more during this presentation. Next slide. So some fast facts about us. We have about 90,000 patients, as I mentioned, many Rotarians. We have 5 locations scattered around the Portland metro area. We're primarily primary care and specialty care with about 110 providers and 500 medical staff, as well as administrative support staff. We're very fortunate. We have deep roots in the city of Portland, and we're going to be celebrating our centennial next year. Up to the time that we went into this pandemic, about 99% of our appointments were in person. Next slide. Here is myself on February 28th. Obviously, that's the date that the first diagnosis of a COVID case came about in the Washington County area. I was out of town on that Friday, but on Saturday, I called our office. We have an urgent care that's located in the Tigard area, and it had a 3-hour wait for service. That's highly unusual for our urgent care. A lot of people thought that they had pre-COVID or COVID-like symptoms, and they are rushing to see whether they had COVID. Obviously, this was the start of the close down. Next slide. So, as Oregon shut down, so did the Portland Clinic. The governor required all elective surgeries to be stopped in mid-March. And, you know, elective is a relative thing. Elective surgeries are things like colonoscopies, orthopedic surgeries, relieving you of pain, a lot of things that during normal times would have been really necessary. But the governor said, we're going to shut down these surgeries, and it really turned off the faucet for us. This represented about a third of our business. We were understanding what the governor was trying to achieve. This was to conserve PPE, protective equipment, as well as to stop the spread of the COVID virus. And so we did that. Now, what we did in turn is in 7 days, which is truly a world record in healthcare, we stood up a video and television program within our clinic. And Dr. Mulcaster will be talking a little bit more about that, what that means. Left our own devices, this would have taken several months to do. And I'm so pleased with our IT department that they were able to achieve this, because this was really the only way that we were going to be able to have a continuity of care for our patients. And so we stood them up, and they are part of us now and will forevermore be. We had to reschedule thousands of patients who had in-person appointments, especially those that were older, those that had comorbidities, and all these patients, we wanted to keep them safe and at home. So probably about a third of our business, a third of those 90,000 patients are over age 65, and we did not want them coming into the clinic in mid-March and April out of fear that they may have a greater propensity of catching COVID. So as you can imagine, this was a logistical task. We also, and this is one of the silver linings of COVID, we also formed a coalition of other independent health clinics in the Portland and Oregon area. These are places like the Oregon Clinic, Women's Health Associates, the Corvallis Clinic, all independent health clinics that aren't part of a system. And we wanted to support each other, share best practices, share how we were dealing with conserving PPE, how to appeal to the federal government for support. And we see this as being one of the silver linings coming out of COVID. Portland and Oregon are places of collaboration. And while we all had worked together, these independent clinics in the past, now we are just all in the same boat. And I think that this is going to help healthcare overall in the future. We also were in a position because literally we get paid based on performing service. We had to really, really be careful of our cash flow. And through the good work of Jim Dunn and others, we renegotiated all of our leases for our buildings and basically pushed payments out for several months, if not years, into the future. This helped us a lot. We also received advance payments from our insurers for value payments and tried to do as much as possible to preserve cash flow during these times. Even with all of these efforts, we still were forced to furlough about 200 of our staff members and close 2 of our 5 branches. These were tough decisions to make, but we did it because we wanted to stay in business. We wanted to serve as many people as possible in this new paradigm. Fortunately, some of these staff members are returning. We still have some on furlough, but these are all necessary things to do. Just by way of a little bit of a scorecard, our gross revenue in March after the shutdowns started dropped by 27% compared to the previous March, 27%. In April, it went down by 75%. So we were only making about 25% of what we typically do for a normal April. It started coming back in May, and we were at about 42% of our average, and we hope that it will keep ticking up. But we, like a lot of business, look at this as being a slow recovery. Next slide. So what we tried to do was communicate with people and tell them what was happening. We wanted to be very transparent, and so we had an external and an internal communication plan. Most importantly, we wanted to talk to our patients. And we have a platform that a lot of patients use called MyChart. And this became the platform where we delivered telehealth through, as well as important messages. Because the important thing to remember here is that just because COVID was happening, everyone else's issues and conditions were still happening. And we wanted to be able to serve patients in a timely manner through the means that we could, through telehealth, coming in for some appointments, but not many, because we didn't want to get back into the world and have a lot of people a lot sicker before the pandemic occurred. We also tried to communicate with our vendors because we had these cash flow issues, and they were very understanding. And the media were very interested about the plight of private health clinics as well as the Portland Clinic. So we ended up talking to a whole lot of reporters during this time. The Business Journal did a great series on us. And if you're interested in more details, please check that out. Likewise, internally, we wanted to talk to our staff about what was happening. Obviously, these furloughs were disconcerting to everyone, and we had changed all the work process. So we did daily updates and continue to do, for the most part, daily updates on new operations. We're owned by 43 partner owners, and we wanted to keep them informed of what was happening. These are all doctors that practice here. Dr. Mulcaster is one of them. and we wanted to inform them of the finances. We heard a lot of good feedback that people just wanted to know what was going on. And then last but not least, we had daily management planning meetings and still continue those on a regular basis today. Next slide. So navigating the next steps in the COVID world, patient and staff safety continues to be a key. And I want to tell you that it is safe to come back to healthcare, whether that be at the Portland Clinic, at Legacy, at Providence, wherever you get your care delivered. We have all taken great steps to make sure that you're safe when you come in, whether that be answering pre-screening questions when you make your appointment, having your temperature taken, and more questions at the front door, appropriate social distancing. We have removed a lot of chairs in our waiting rooms, wearing masks, just a whole lot of things to make sure that you feel safe. We look at the post-COVID world, or whatever happens tomorrow onward. Our payer mix is going to be different. We have about a third of our patients under some form of Medicare or Medicare Advantage, but about 2/3 were previously covered through commercial insurance. And so that payer mix will probably change with the rise in unemployment. We're also rethinking our bricks and mortar strategy. We're planning for a new downtown clinic, and that downtown clinic might be smaller, and it might include more components for telehealth. And so bricks and mortar will be something that we'll be talking about a lot more. I mentioned our collaboration with healthcare partners in the community. That is really a silver lining out of this. We'll be talking about telehealth more in detail here shortly. And I quite frankly think we're going to have a leaner staff structure. All of healthcare will be, because there's going to be new jobs opening up in areas, but there are going to be jobs that are no longer needed. And so all of this, I think, will be look at leaner healthcare, which should reduce overall costs. Next slide. I'd like to just do a shout out to some Portland Rotarians who have been extremely helpful during this time. First of all, past President Darren Hahn, his church has donated and made 800 masks and counting for our use for patients. Thank you, Darren. I mentioned Jim Dunn, who really worked 3 weeks straight to help rewrite all of our leases. And Jim and I run every Saturday or Sunday on the weekends. We haven't been together in 3 months, but we've started a virtual run where we both meet wherever we're going to run at 7:30, our respective locations. We both run, we return to our respective homes, and we have a coffee. Jim has helped me keep me sane and healthy during this time. Thank you, Jim. Bob Dernetti. Bob serves on our TPC Foundation. Our foundation kept churning during this time, collecting gifts from grateful patients, doctors, staff, and we just recently awarded $75,000 in grants to local nonprofits specifically for COVID aid. AJ Barnett hosted us for a Zoom happy hour sharing the same story. Kate, I mentioned your great leadership, and many, many other Rotary friends who checked on me. Rotary has been a big part of my sanity during COVID, and I'm very appreciative of it. That ends my portion, and now I'm going to turn it over to my colleague, Dr. Amy Mulcaster.
Hi, everybody. I just want to say thank you for the invitation to speak to all of you today. Can we have the next slide, please? You can go one more. Next slide. Thank you. So as Dick mentioned, basically our whole world in healthcare was rocked in March, and we were scrambling to find a method to connect to patients. Unfortunately, due to our diligent IT team, we were able to, like Dick mentioned, get our telehealth expanded in 1 week. Nothing ever moves fast in medicine, as I'm sure you're all aware, sitting in waiting rooms, waiting for physicians or providers. And so for us to build this platform and have patients successfully access it was really a challenging feat and a very successful feat for us. So on March 13th, 2020, you all know a national emergency was declared due to the COVID pandemic. And pretty much every state had some sort of stay-at-home orders across the country, which really produced a need for our telehealth visits in order for our patients to access medical care. Like Dick mentioned, many patients were looking to emergency rooms for COVID care, but for patients without symptoms of COVID, medical care is certainly a necessity for chronic medical conditions and acute illnesses that didn't fall under the umbrella of COVID symptoms. In general, across the country, telehealth platforms have existed, but very slow to expand. They're really accessible to people that lacked service in rural areas. And some of the larger health systems provided some telehealth, but it was really very limited. Statistics from the Epic Health Research Network, which Epic is a medical records, electronic medical records platform throughout the country, noted that there was an increase 300-fold in telehealth visits from March 15th to April 14th. And here at the Portland Clinic, we provided 3,400 video visits in May, which is 25% of our total visits for the month. And then continuing into June, even as early as last week, we still had 21% of our visits that were done video. Next slide, please. So you can see the patient age range of telehealth use during the COVID pandemic. This is again from the Epic Health Research Network, spanned all age groups really. In February 2020, Epic recorded 300,000 visits and peaked at 2 million visits across the country in April of 2020. Next slide, please. So telemedicine and telehealth visits are really helpful because it has gives access and ability for anyone with a mobile device, anyone with a camera or a microphone enabled laptop or computer to access their healthcare provider. It eliminates transport concerns, travel times to offices, waiting room exposure and waiting room times, and it enhances patient comfort. They're able to interact with their own provider in the comfort of their own home without the worry of sitting in a waiting room and potentially being exposed to COVID or frankly, really any other virus or respiratory problem. Telemedicine and telehealth visits are HIPAA compliant. The visits are not recorded. They're video and audio encrypted. And currently at Portland Clinic, we're using 2 different platforms. As Dick mentioned, we have a patient MyChart platform through our electronic medical record system, Epic, in which a patient can access their own medical records. They can email their provider through a patient protected HIPAA compliant portal. And that is the same portal that is used when a patient logs into the Zoom platform. So it is different than the Zoom that we're using for business meetings because it is a secure patient portal so that patients can be reassured that they're having a private visit with their healthcare provider. The other option we're using currently is called Doximity. Doximity also is HIPAA compliant. It is a little bit different in that there's no application that needs to be downloaded on a mobile device or a computer, whereas Zoom needs to be downloaded and accessed through the actual patient portal and through the patient's chart. Doximity allows patients to log in right through their mobile device without accessing their patient health record. I've done visits with patients on both interfaces. Both are very easy to use, and certainly our IT department in challenging situations have been able to intervene so that we can complete the visit. And patients have been very grateful for these platforms. Many times the visits that I've done with my patients, the first 5 minutes of the conversation really is just checking in with the patient, seeing how they're doing, and then them expressing gratitude that we have this platform so that they can have their healthcare needs met without leaving their house. Next slide, please. So here's some video visit tips that are helpful for anyone that's going to be using a platform like Doximity or Zoom. You want to be sure that your device is fully charged and that you have a reliable internet connection. Make sure that your audio is enabled if you're using your phone or if you're using your desktop or laptop. And you want to sit in a private area. Certainly, these are private issues a lot of times between providers and patients. And so having a good area where you're not going to get interrupted is really helpful. Lighting is really important. Sometimes you'll see patients with a bright light behind them and it's difficult to see their face. So you want to avoid windows directly behind you if you're doing a visit with your provider. And also trying to keep background noise to a minimum. Certainly sometimes that's impossible. I've seen lots of moms recently that have their kids and pets at home, which is completely understandable. But in order to really engage with the provider, it's really useful to keep background noise to a minimum. Next slide. So in summary, the future of telehealth, telehealth implementation has been a silver lining of the COVID pandemic. So I think we've seen quite a few silver linings coming from it, and telehealth really is one of them. It's really a point of entry into medicine for patients who otherwise have barriers to medical care access. And it's a certain necessity and access to care in situations like a pandemic. We really consider it a mainstay for the future. Patients are grateful for the interaction, and really it's going to be an expectation, and it should be, for providers to provide this access to our patients and have it in our tool bags so that patients who have certain situations or certain barriers to coming into the office can have their medical needs met. Thank you, everybody.
And thank you. Thanks to both of you for being able to do this presentation today. Now's the time when I kind of turn it over to the group that we have participating today, and raise your hand if you have a question for Amy or Dick. Looks like Chris does. Go for it, Chris.
There we go. So in your discussions with physicians in your group and the community, how do you see this event impacting the discussions on the future of healthcare in the United States, both from the standpoint of the idea of universal healthcare, but also because we've seen a number of local community hospitals stressed to the point of going bankrupt? How do you see the situation working out as we figure out how to provide healthcare in a somewhat even manner, not only in major urban areas, but in rural areas throughout the United States?
Well, Chris, I always appreciate your questions. They're always macro, big, and can go a lot of different directions. You know, I think we had a problem in rural healthcare before this pandemic hit, and this has just exacerbated it a lot. I'm working with, as part of this coalition, the North Bend Medical Center down in Coos Bay, and they've been hard hit for a variety of reasons. I think some things that they're doing to stay afloat, certainly they've got a fair amount of federal aid because that is necessary in those rural communities. I think telehealth is going to help them a lot. The trouble with telehealth in some of these rural areas is that they don't have the broadband connections, and so that's something that is going to have to be shored up as well. And then just attracting doctors to rural health. It's always been a challenge. But I think we have those same challenges in urban areas. So much like a lot of things, this story is still being written. I think some of it will pivot on what happens with our election in November as well. But our hope is that we'll be able to meet the patient where they need to be met. And as Dr. Mulcaster has talked about, I think a fair amount of patients are going to appreciate telehealth as being part of our offering, whether they're located in Portland, Coos Bay, Eugene, Bend, Prineville, wherever they might be. I'll let Dr. Mulcaster give her point of view.
Yeah, I would echo what Dick says about those problems just universally existing prior to the pandemic, and now continuing to be issues as we're moving through this pandemic. I would hope that if telemedicine is going to be here for the future, and we really hope that it is, that we can figure out a way that would be also an aid to our more rural patients. And again, you know, we're not talking about building a new network, but maybe just increasing the bandwidth. And I think providers are willing to engage in that. I agree with Vic. It's been difficult to recruit, you know, doctors in the rural areas. And actually, my first job out of practice was with a 25-bed hospital in rural Michigan. And certainly it was a difficult time. But I think, again, those challenges need to continually be addressed. And they're really difficult issues to solve. But at least talking about them and continuing to try to think of solutions will hopefully head us down the right path.
Great, thank you so much. Does anybody else have any questions? Looks like Jim does. Go for it.
Since Chris brings up the macro, I'll bring up the micro. And I've been a longtime patient of the Portland Clinic. And my primary care doctor is Dr. Kim out in the Beaverton office. But I also see Dr. Rohrbach in dermatology, and I see Dr. Tan in ear, nose, and throat. So how does telehealth impact me on my regular daily care? Is it, I mean, my dermatologist probably can't treat my skin problems for my Irish sunburns, you know. So how does telehealth actually work for the ordinary patient?
I think Dr. Mulcaster, who sees patients in her specialty, can answer that best.
Yeah, Jim, that's a great question. And I would say too, there are some specialties that telemedicine lends itself to easier. But I will say that in all those specialties, ear, nose, throat, and dermatology, an initial evaluation or a discussion for a new problem could be initiated through telehealth, and then you know, talking about the further plan for an in-person visit. I'll also say things like medication checks or consultations or opinions on you know, health care issues. Telemedicine really lends itself to. So there are specific things, certainly if you're scheduled for a skin biopsy, that can't be accomplished through the screen, obviously. But I would say that our dermatologists, I know, have had video visits with their patients initially, and even just to formulate a plan. And I would say also that to formulate a plan on a video visit can save patients more time because the video visit, you know, is, you know, have to sit in the waiting room or travel to the clinic, and then preparation during the video visit for an in-person visit, so that you do have not just maybe 2 visits to prepare for something that you actually have to physically drive to, but maybe just the one to execute the plan that was discussed at the first visit. So I think anybody in any specialty could make a case for a video visit for their specific concern. But I do think, you know, as far as active or procedure specialties, certainly those are going to have to be done in person, of course.
And Jim, I might just add, you know, in the unfortunate event of a second wave of COVID, I think we're all going to have to be more comfortable with the delivery of healthcare that way. Certainly the Northwest wants to prepare appropriately for a seismic event, and telehealth could play a role there. So as Dr. Mulcaster said, I've been very impressed with how creative our doctors have become in delivering healthcare, even physical therapy appointments. I mean, you would think that physical therapy, you would need to be right there in the room. You can do physical therapy training through telehealth. It's really creative.
Thank you for those questions. Is anybody else? Leslie, what question do you have?
I'm curious how the insurance business is accepting telehealth, because they seem to be running the show here, unfortunately. Thoughts?
You know, that's a space I'm working in a lot, Leslie. Prior to the pandemic, doctors were reimbursed in some certain cases substantially less for either telephone visits or video visits. And in part, the justification was that you weren't in a bricks and mortar type facility. This coalition that we're working with and myself really are making the case that time is valuable and doctors' time is valuable. And if we're able to get some of the same results from telehealth by having people avoid more complicated procedures or visiting the emergency room, that's to the benefit of insurance companies. So we're working on some legislation right now that hopefully will be introduced in the short session of in later June that makes a strong case of what's called telehealth parity, where regardless if the medicine or telehealth is being delivered by phone or video, it should be reimbursed at the same rate as what an in-person appointment is. And we have a lot of legislators that we've talked with that are on board about this. So hopefully this is something that's going to become permanent. The state of Washington passed this about a year ago. It was supposed to go into effect on January 1, 2021, but the governor said if we were going to put it in place in January, we're going to make an emergency declaration. And on the first day the pandemic was declared in Washington, they became across the board telehealth parity. So we hope to follow suit in Oregon.
Great, that's another great question. Does anybody else have any other questions? All right, doesn't look like it. So thank you so much, Dr. Mulcaster, as well as former president of our club, Dick Clark. Thank you so much to the both of you for making the time today, and congratulations on keeping everything kind of spinning and going and moving along, because as many of our Rotarians, as well as many people in our community, do rely on the clinic very much. And I'm so happy that you have just been figuring out as you've been going along. So thank you for sharing the whole story with us right now. Appreciate it. And if anybody else has any questions and you're watching this video, please go to our Facebook page. You can post a question for either of our speakers today, and perhaps we can get some answers from them that we can then share at our next meeting, which I'm excited to tell you about. So we don't have it locked down yet which speaker we're going to have, but there is a change. There is an announcement I am going to make right now, and that is that we are changing things up a bit, but hopefully this will be the last change up, because we're going to go back to live meetings. I think we have the technology figured out, doing a few things this week to make sure we have it all figured out so we could have all of our membership, all 220 members could show up, and we would be able to hold the meeting and have it not be too crazy. There's a whole way we're going to do it. So please join us next Tuesday. So it'll be Tuesday the 23rd at noon. You will receive other information later this week to find out how you can participate and be there for the live meeting. But we are very excited that we are going to be able to do this, because I miss all of you. I miss seeing faces. I miss seeing fellow Rotarians. And I know that goes for many of the other Rotarians in our club, that we just kind of miss seeing each other. Thanks again to all of our speakers today. Thank you, viewers, for watching this. Again, it's great if you are watching it with some family, with some friends, because then they can understand what Rotary is and also what Rotary does in fellowship and in service. I also meant to say earlier, actually, that if you would like to do a reflection at one of these meetings, we'll still be on video, it'll be live, but we'll still be on video. So please contact the office, contact Siobhan or Corinne to find out how you can get on the reflection schedule. And again, the same few online fellowship opportunities continue to happen each week. 10 a.m. Tuesdays, Fridays, there's the online coffee room. Thursdays at 4, AJ has been hosting the online social, where we get to hear some current industry insight from a different Rotarian each week. It's a Rotarian only participation. It's short, it's about half an hour, but we've been hearing from many people in many different industries. And this Thursday at 4, it will be Steve Watts, past club president, and he will be talking about community baking industry insight during these pandemic times. Of course, Rotarian Angel Pilato has orchestrated a recipe gathering. So if you haven't been receiving her emails, make sure you reach out to her to get that. But she's been gathering together Rotarian different recipes as well as photos to go with the recipes. It's been helpful for those of us that have that moment in the day when we realize we have no idea what we're going to make for dinner and we don't exactly have that option to go out and sit at a restaurant and eat. So it's a helpful thing that she is doing, pulling all that together. And lastly, please do go to YouTube and go to our Rotary Club of Portland page because you can find out other video updates and other news. As always, take care of you, take care of yours. Reach out to a Rotarian this week, say hi, check in on them, see how they're doing, and let's continue our service work because we are still doing that. And that way we can say that we are committed, we're very committed to service above self. It is more than a motto, it is a Rotarian value to uphold. Thank you again, and this meeting is adjourned.